As it? Yeah, good morning, everyone. And there are still people joining, so let them also.
Good morning, Dr. Sir.
Hello, Arvind.
Hello, sir. How are you?
Good, good, all good. So,
Nice to be here, sir.
once again, very good morning. It's a very shiny Sunday morning, and this camp is happening for the first time ever online. It's a new concept. We keep on, coming up with innovative concepts in healthcare. And this journey began way back in 2008 when I decided to, keep my um, original profession as an eye surgeon to one side and went into a deep state of research. That followed 5.5 years after that, I was able to uh, give to my team the basic prototype through which the voice was being recorded through laptop and a mic. Then we went through with evolution into this technology. We started developing an Android app, which was which was done in 2016, and it helped us, uh, you know, uh, get voice samples from people all across the world, and that was all manual. For the last 3.5 years, we were, integrating artificial intelligence into the entire system, so that you just record your voice at home and get your full body reporting, recommendations, interpretations, and of course, if required, your sound frequency prescriptions for healing. So I'll start with a brief presentation and I'll take you through the whole process, how you are going to be benefited with this. We'll give you a demo. I'll give you three links. First will be that you'll all have to download the AI app from Play Store. And after that, I'll teach you how to record voice. You'll all be getting your full body reports right here itself. So I'll begin with my presentation. So, am I visible? The slides are visible? Are the slides visible?
Yeah, it's visible.
All right. So, I'll begin with the slideshow. So, who we are? We are a healthcare startup by the name of JV Scan Private Limited, and we are into preventive voice analysis healthcare solutions. It is a home-based digital preventive healthcare application. Yes, it is an application, and the sensor used in this technology is your own voice. That with AI is it's transforming lives. It's giving very good results to people who are using it because it helps us in pre-illness detection when the disease is not visible to the traditional allopathic doctors by whatever means they try, whether lab test or any other testing. It gives you a full mental health, blood health, physical health, DNA health, and overall health reports. And each parameter here, which I have defined, like mental health, has a few more parameters that I'll show you today as to what you're going to get when you actually go for this reporting. This is me. I am Dr. Mahesh Utmani. I'm an eye surgeon turned entrepreneur and innovator. This is what we were doing pre-COVID. We were creating awareness with interactive workshops. Like this is one attempt that we started, but that time we didn't have the AI app. It was all manual, and COVID, these workshops were all offline in different parts of India. A few awards since 2018, best startup in healthcare to best innovation. Then we were also felicitated at ICT Awards 2019 by Government of India. Then we got Go Global Awards front runner. And recently, on 15th of August, uh, our female director, Shakuntala Roy, was awarded for excellence in women entrepreneurship by the Education Minister of Punjab. And that happened under the sponsorship and guidance, as you would say always, guidance of Punjab State Council for Science and Technology, who have been very helpful towards what we do. They always encourage and support us in our endeavors towards uh, digital health. We are also incubated at TBI ISA Mohali for the last 2 years. They are our mentors, and we feel lucky to have two big organizations, as I mentioned, to have their support, their mentorship along with the journey that we are conducting, and in bringing up healthcare as a very different solution as you see today. So for this accuracy and reliability, we had a very small scale study in which we actually correlated the accuracy of traditional tools of diagnosis with voice analysis. The results were very good, 97% of accuracy. The paper publication was done in October 2022. The paper was published in International Journal of Innovative Science and Research Technology. Following that, we were granted a patent certificate which says it is hereby certified that patent has been granted to the, uh, I don't know what is, it's very minor, for an invention called voice analysis, a preventive healthcare diagnosis tool. This patent is granted for a period of 20 years. Why we actually took up uh, uh, this path towards disease prevention? Because of the early uh, core problem of early disease detection or pre-illness detection. Now, how many people have experienced this problem? You go to a hospital, and the doctor would give you a set of lab tests, and 90% cases you would come out with nothing in, because the disease has not reached there at the level of the blood. So this cannot be pre-illness or early disease detection. Now there's another word called secondary disease prevention, means to have certain tools that can help you identify disease at a level where the disease is symptomless. It's a latent form of a disease. The disease is hidden, but it is still progressing in the mind through various stages, so that it will further enter the blood and then into the body. So these are a little bit of medical terms. So this I have already described. A core problem of early disease detection is the main thing which people are unaware of, because if you get delayed diagnosis or advanced stage disease diagnosis, uh, the outcome of treatment becomes poorer. There are less chances of full recovery. There are more sufferings when you get hospitalized during end stage or advanced stage diseases, and of course cost is definitely a very big factor, wherein people who have earned their hard-earned money, work throughout their lives, they spend their money in, within the non-comfort zones of hospitals. This results in emotional reactions, as you see, and everybody must have gone through this stage from some time or the other. And then it results in increased healthcare utilization, non-compliance of patients, higher healthcare costs, mental health challenges, overuse of medical tests, because each doctor has given a test and everybody is moving around to, have those tests done, like trying to actually, in a hidden trial manner, as to whether these tests would be okay or not. And when you actually understand this, and when you get your report, you will understand that these tests, which we have actually recommended based on your voice, are the ones to be done. And there are no other tests, because we found more than 90% accuracy when we did a small observational study. Uh, People going with their lab tests, given by us, and they were positive as per the recommendations and interpretations given by the AI algorithm. So there are options. There are options. These are regular screenings biomarker testing, genetics testing, but they are not very accurate. They apply on only one particular organ or a disease or an antigen, especially for colon cancer, there'll be only one antigen that would be screened. So these there are limitations, and they cannot be classified as regular tests because they are being performed on blood, while when we talk of our system, it is being performed at the level of mind, and it can give you predictive analysis of all the blood elements which will go here or hayway in a due course of time, and of course organs and other muscles and blood elements, how they will be affected later on. The entire system gives you a complete picture. So it's not much to say here. So we'll have to understand the solution, which is voice analysis with AI as a pre-illness stage diagnosis tool that fulfills the guidelines given by the World Health Organization as a secondary disease prevention tool way back in 1984 Geneva Convention. So what it does is like uh, record a 30 seconds sample using AI algorithm sitting at home. No need to go to any hospital or doctor until the application advises you to do so. So you can understand how much comfort it is giving you, how much convenience it is giving you, how much personalization it is giving you. And there is no need until and unless the application tells you to do so. So what we do is like 30 seconds of voice, we record the missing and the weak frequencies. And we are doing this by way of body frequency mapping because it believes that because our body is made up of frequencies, and there was no other way than this before that actually identify these missing body frequencies. So unmute yourself. Yeah, thank you. The solution now, there are three levels at which you will get your reports. One is the emotional level. Emotional level is what? Stress. And it is a mixture of more than 1,000 emotions, negative. So we'll come to know if your emotional state is going to be deranged or not. You'll come to know if your emotional state is deranged already, and methods to bring back that emotional stability, peace, and inner calm. You will get to know about these methods. At the blood level, we do all vocal biomarkers, 200 plus, whichever are happening through blood, and the accuracy during observational studies has been good. We are ready now to do a small scale observational study and stake a claim with a patent and everything, paper publication. At the body level, you will come to know which organ of the body is weak, so that you can get immediate referral to a treating doctor, a general physician, or a cardiologist, wherein normal tests would be performed on you, which would have been delayed by maybe 6 months or 1 year if you had not taken this solution. So this is how this system works. So in brief, it is voice analysis helps in early disease detection, mental health mapping, organ risk mapping, and modern day diseases. If you start using this system, anybody starts using this system, definitely it's going to decrease the load of morbidity, which is illness. And definitely the healthcare fraternity would be very happy to see less crowded hospitals, and uh, they can deliver a very good quality of healthcare as against today's practice. It can help in remote health monitoring, blood health monitoring, vocal biomarker analysis in the blood for cancer, heart health, lung health, sugar health, liver health. So there's no need to go for any painful lab tests which draw your blood. Now it is going to happen through your voice, everything. Uh, as again, early diagnosis you can get through vocal biomarkers and disease identification, mental health mapping. You can get chakra, 7 chakra analysis, 5 meridian analysis, 12 meridian analysis, 5 element imbalances. Then emotional states, you have stress, depression, anxiety, anger, panic, fear, and a lot more. Blood elements, we are main focusing on neurotransmitters because of mental health issues. related to transmitters and hormones. Of course, electrolytes, minerals, vitamins, amino acids also play a vital role in mental health. Uh, so we have more than 200 biomarkers like HB1AC, tumor biomarkers, biomarkers of heart. So this is how it does. When you record your voice in your AI app, which I'm going to give it to you, you will not see this. This is the basic prototype model where the voice was recorded, and you will see we measure 36 frequencies. 12 are here from C major to B major. There is a pink line, and then there is a line below the pink line. So it is all about the identification of these. These are missing frequencies. These are weak frequencies. So the health reporting is based on the uh, identification of this particular pattern in a voice grid, and everyone's voice grid is different. As your eye spectacles with a prescription are different for yourself, your vocal sound frequency prescriptions are also different. So you cannot use anybody else's. Uh, See, all diseases are born in the mind and they get into the blood. So that is the reason our system has a USP that we detect diseases at the level of mind, right? We are detecting diseases at the level of mind. Traditional allopathy goes beyond. We do the root cause analysis, which you will see. In your report, you will have it. You'll have a few negative emotions. If at all you have, it will give you that. So what we do is, if we find that the disease is at the level of mind, we give sound frequency prescriptions. If it is at blood, we recommend lab tests. You can get it done. And if it is at the body level, it's doctor referral immediately for further uh, tests to come to a conclusive diagnosis and further treatment, which is early. Early in terms of uh, duration and probably months. Uh, if you wouldn't have used this system, you wouldn't have known what is brewing inside your body, and you would be visiting your doctor maybe 6 months or maybe 1 year later with a disease which is more progressive and advanced than this particular day. Now we are heading towards building a futuristic healthcare ecosystem, which is phase two. USP, it is evidence-based approach. We have all scientific evidences, validation in the form of a patent. Then it's a non-invasive detection. It is cost-effective. Early and pre-illness disease detection is possible. It gives you personalized insights and personalized sound frequency prescriptions. It empowers you to take proactive health care of yourself. And apart from that, there are many which and the value proposition, if I define the end user has some apparent needs, and when we provide this solution, it's a perfect match. And during this quantification of value proposition, we found that long-term benefits was 700% as a perceived value, while short-term came out to be 212%. So it's a very good figure, good this thing. This is how we used stress uh, increased from a score of 8 to 360% reduction. Sleep improved by 133%, emotional stability by 133%, body energy levels increased by 250%, social adaptability. If a person is it has an element of social stress, cannot interact or communicate with people all around, for them, this is a boon. You can start communicating with a 75% increase. Coping up increased by 133%, and long-term benefits 700% with an overall improvement in perceived value of 212%. That means if a person who's spending 100 rupees with us will get a value which is 212% of that 100 rupees. I think it is 2000 rupees or something. I'm very bad in mathematics. That would be the perceived value. So in the end, I would like to introduce my team to you. As you see, I have already talked about myself. Shakuntala Roy is the strategist with us. She's done her IM from Kolkata. She's the director. I'm the founder and director. Then we have Arvind Modgil, director of business operations, and we have Dr. Rahul Khaturiya, chief health officer. He's MBBS MD anesthesia from PGI Chandigarh. He does a very good role in our company when it comes to taking care of all the compliances, R&D research. So this team is good. We are performing our activities almost every day, and this was all about what you are going to get. Now I'm going to show you the reporting. So just stay tuned. I'll show you how your reporting looks like. Is this visible?
Yeah.
Okay.
Yes, sir.
So it gives you a list of parameters which will be taken care of. Then a bit knowledge about what it is. How does it work? Gives you a little bit knowledge about body frequencies, what are normal, weak, missing, and hyperactive frequencies. And from here, your body frequency mapping starts. So it gives you the number of missing frequencies is 16 in this case. Weak is 1, hyperactive is 13. Based on that, I think this is an old report which I'm showing. The format has changed. Now, we come to mental health mapping. 4 parameters are used: positive traits, negative emotions, coping up, and 7 chakra. See how it works. If a person has positive traits, these 3 columns will be full of positive emotions. In this case, as you see, the system has uh, populated and given a few traits like charismatic, knowledgeable, intuitive, master of self, trustworthy, honest. And if this coping up, I mean, coping up is coming late, positive traits, this is. So it gives you a score of 1 and 1. Now, if you have negative emotions in the subconscious, like loss of concentration, learning difficulties, insecurity, this will go in 10 minutes and I'll rejoin because I have not used the professional one. So you all guys, please stay there. I'll be back once this happens, if it stops. Then it gives you a score of 0 of 1. Then coping up mechanism, if it is active, you'll have more masculine features or confidence or serenity. And it is negative. If the coping up is inactive, that means you'll have more of negative emotions populated here. Then this is 7 chakra scoring. It gives you a score of each chakra, which one is active, weak, which one is normal, which is hyperactive. So this reporting comes like this. Then we have your overall mental health score. All the scores are put together. Then you get interpretations that you have presence of negative emotions or trapped emotions. Coping up is active, and you may require emotional healing with sound therapy because of root cause, like that. Then disease progression, what stage of the disease you are in, whether you are at the level of blood, you are at the level of mind, or you are at organ level. So there's a scoring system for each. Here it says that it is stage 6 of disease progression, and the recommendation is please visit your physician at an earliest. So we are not, mixing up where it is required. We are sending the patient there only. Now about the lab test. Yes, there were missing frequencies at the blood level, which I'll show you. These frequencies in the line, which is the last line, this is a missing frequency, and there could be many in different cases. So based on that, the lab tests are populated. So it has given vitamin B1E, lipid profile Graye, troponin A, amino acid cysteine, serum calcium, iron. All these are recommended. Then physical health, immunity mapping, it will map the scores of 7 organs responsible for immunity and give you a score. In this case, it is 6 by 7. So the recommendation is at the time of voice recording, your immunity is normal and you have less than 10% chance of acquiring a disease. It's a low risk. If it is 3 out of 7 or 2 out of 7, there will be different interpretations and recommendations. So in this case, we say, okay, come back to us after 6 months. But if the immunity is low, we are not asking this patient to come to us. This patient goes directly as a referral to the doctor. Then organ risk. In this case, there is no organ risk. Otherwise, there would be some the columns showing the list of organs which are at risk. That means immediate referral is to be done to the physician. Now, yeah, it is showing here. Joints, BP disturbances, column, skin allergies, migraines, gallbladder dysfunctions, high blood pressure, heart problems. So these are the organs at risk in this case. So the scoring system also is like that. So you'll have to check yours, what scoring system is coming, which is the weakest in your physical health score, and then based on recommendations, you can take action. You can also I'll be giving you a calendar link. You can book an appointment, the free appointment. You can book with me and discuss your reports. And in case you want more detailed reporting, we can discuss that during this one-to-one call, which is 30 minutes. I'll be giving you the earlier app, which is so detailed. I mean, we could not put all the data because this has to be at least 20 pages. But then if I uh, speak with you on the phone, and when you use the older app, you will get much detailed things, which this may have missed because this is very short and concise. So that option is there. You'll get 3 links. You decide which link you have to use and how you have to, book your consultation with me if you have any issues related to reading of the report or an understanding of the report. Now, it also gives you the analysis of blood elements like mineral score 41%, hormones, neurotransmitter score 50%. That means you have to correlate this with the root cause. If it is 50%, definitely a person has some mental health issues. So this is how it works. Interpretation and recommendations. Then DNA health. It will give you the percentage of healthy DNA and sick DNA, because this happens when the disease is gone uh, inside the body and involved a particular organ for more than 3 to 6 months. This picture will come. DNA scores come only when there is a chronic disease. Then overall interpretation you'll get. And as you see in this case, mental health mapping shows a score of 0.6. So the focus of treatment would be on mental health. Yeah. We give sound frequencies, which are unique to you, yours only. So this is how the new reporting looks. If there are any queries, आप पूछ सकते हैं. Let's have a little bit of interaction. Shakuntala, you you
So in the session, you mentioned there would be 3 app links that you are giving, and we need to decide which one we want to use.
no
But
no
what is your
no
recommendation?
no. I said I'll give you 3 links. One is the link with AI. If you feel that your report should be more extensive, then you can send me your voice samples through a different link, and that would be much detailed because we have not been able to put all the data inside this. लाइट गई भाई. ना मैं डाल रहा हूँ उसको, रुको. ऐप का थोड़ा बोलोगे, अब उसका डेमो करते हैं, बीच बीच में आओ.
There is some connectivity issue. I'm rejoining doctor again. अब जो है आपको जो कैसे
Yeah, there was some power cut, so I'm back now. So now I will show you how to use the app. Before that, I'm going to give you the link. You have to download it. Please check your messaging here. This is the link you need to download now on your app. Has everybody seen it? सब लोगों ने देख लिया?
मोबाइल पे इसको डाउनलोड करना है.
Has everybody seen this link which I have shared? आप सबको ये लिंक मिल गया है?
Yes, yeah.
हाँ, आप इसको डाउनलोड कर लीजिए.
It's in the chat window, everybody.
Yeah.
It's only for Android, right?
I think it's only for Android now, Dr. Saab, correct?
I think it's a network issue.
Yes, presently for Android phone only.
I think it's for Android only. There is no iOS.
Yes, it is for Android.
It's only.
It is for Android.
Okay.
Yeah.
So, sir, is there any way like